For some reason, this week's Arlington Town Hall meeting was pushed back to 12:30 p.m. The meeting did start fairly promptly at 12:31 p.m. Attendees included Katie Crystal, Matt DiFerrante, Jim Schwartz, Dr. Ruben Varghese, Dr. Aaron Miller, and County Manager Mark Schwartz. Katie Crystal began by acknowledging the region's relative delay in reopening in accordance with special permission granted by Governor Ralph Northam. Matt DiFerrante announced the opening of the walk-up testing facility at the Arlington Mill Community Center. He provided a phone number, but only gave it once. For people with slow reflexes, that number is 703-558-5766. Again, that's 703-558-5766. He also stated that Arlington's grant program for small businesses was still open and gave the end date for applications, but again provided it only once. And unfortunately, the website's posted deadline is Sunday, May 17th at 11:59 p.m. By the time most people hear this, it will have expired. Mr. DiFerrante did go on to provide some updates. As of the meeting date, Arlington had a total of 1,581 confirmed COVID-19 cases and 71 deaths. That's the reason the stay-at-home order remains in place. Katie Crystal then read a few questions that had come in. One was, why is the reopening being delayed? Jim Schwartz provided the simple answer, bad numbers. Dr. Ruben Varghese amplified this somewhat, saying that the hospitalization numbers were not declining at the desired rate. While there had been some improvement from 4 good or declining days out of 14 in the previous period to 9 out of 14 good days in the most recent period, the goal of 14 consecutive good days had yet to be reached. Katie Crystal read another key question. What is Arlington doing about testing? Dr. Aaron Miller responded that there were multiple considerations. First, there were the things that Arlington could do internally with their own resources. For example, it was necessary to match the right test to the need because some types of tests had failed to detect infected patients. Second, there were things that depended upon state resources, such as the testing specified for vulnerable populations like nursing homes and prisons. Third, there was the help that private providers could give. Dr. Miller did offer that Arlington had completed over 3,600 tests at the drive-up locations and that this placed it in the top 10 jurisdictions in Virginia. However, this top 10 designation would have been more meaningful if it had included the number of other rated jurisdictions and if it was related to per capita testing as opposed to just having a high population to test. Another question was, why are referrals needed to obtain testing? Dr. Miller and Dr. Varghese both agreed on a simple answer. It is both a requirement by the Virginia Department of Health and a nationwide legal standard. Dr. Varghese also pointed out that a single negative test did not provide any assurance that that patient would not be vulnerable to some future infection. Mr. DiFerrante read some other questions, starting with, what about summer camps, recreation centers, and parks? Jim Schwartz responded, the summer camp decision for Arlington will be made next week, but most of the neighboring areas have canceled summer camp for this year. Recreation centers, since they involve indoor activities, are likely to be restricted to 50% occupancy even when they are opened. And finally, a decision on the parks will have to wait until after May 28th. Mr. DiFerrante offered a pair of useful statistics. While Northern Virginia has only about 1/4 the population of Virginia statewide, they have over 1/2 of the confirmed COVID-19 cases. They are simply not doing as well as the rest of the state. Katie Crystal read a question about masks and mandates and explained that Governor Northam would be making a formal statement later that day. The question of what happens after May 28th was raised. The simple answer from Dr. Varghese was that the scientific data would be re-examined at that time and recommendations would be made, even though the decision about reopening would come from elsewhere. A question arose about contact tracing. Dr. Varghese explained that it was a process that had been in place for decades and that it was used to determine who had exposed a symptomatic patient and, in turn, who that patient might have exposed before their symptoms developed. Some questioners asked about regionalism and why Arlington couldn't just work within their own data. The answer was simple. People in the D.C. metro area move around. A question about antibody testing was handled by Dr. Varghese. Although antibodies are useful in determining whether or not a patient has been exposed to COVID-19, their presence does not guarantee immunity. Someone also asked about the disruption of yard waste pickup. Mark Schwartz explained that the contractor that Arlington uses has suffered staff reductions due to the virus and that the situation was expected to be temporary. In closing, it was explained that personal responsibility was the best policy and that cloth face coverings not only protect others, but reduce the individual's inadvertent touching of their own face. The meeting ended at 1:32 p.m.